That's really great to hear. And the reason why I also bring this up is, in this age group, right? Like we don't really like the words perimenopause and menopause, and especially in this day and age, right? Because a lot of women can be taking care of their health and they don't want to associate, and certainly in our minds, we don't think we're getting older. And yet the reality is our hormones, they do start to decline. I mean, that stuff is real. So there's only so much we can do.
In a previous episode, we were talking about cyclical progesterone for polycystic ovary syndrome, and I have found it to be very useful personally for perimenopause as a woman with polycystic ovary syndrome. And I've used it previously clinically for 17 years. Only recently got my prescribing license in 2017. Well, not that recent, but previous to that, I would work with a medical doctor who has since retired, who prescribed cyclical progesterone for my patients. And I've seen it really effective for women going through perimenopause because of the cycling estrogen that can go really high some months, because the brain is saying, to the ovaries, hey, wake up, we need that last hurrah, let's try to make some babies last minute here, right? So then you get some months where you get an excess amount of estrogen from producing 2 follicles, which is, and then extra estrogen, like double the amount of estrogen, so 2,000 units, if you were to actually track it on blood work. And that can cause, that high to the low can give patients the feelings of hot flushes or insomnia, mood changes, migraine headaches, joint swelling, like just with the highs and the lows and the cycling, and anxiety and just all the changes. Or not in my case, but women with, irregular cycles where, well, not my case yet, and hopefully not, but women will go through, irregular cycles starting in perimenopause. So maybe they were regular their whole life, and all of a sudden, they're menstruating 40 days apart, 60 days apart, or 3 weeks apart, and they're all over the place. And in those circumstances, especially the weeks that there's no action happening, so no ovulation, women are sitting in a kind of a post-menopausal hormone state where their estrogen and progesterone is way down. And then replacement of hormones can be super helpful, and cyclical progesterone can be really helpful for that kind of instance where progesterone can help a woman sleep. Like I find that that's a really big concern, like the insomnia that can come with periods that are irregular and all over the place. And me personally, I mentioned in our cyclical progesterone episode, I had started to notice the premenstrual insomnia. I'm turning 45 this year, and I'm doing, me, I do everything I can for my health. So exercise, good nutrition, try to sleep at a good time. And so I wake up without the alarm clock, and try to do some regular grounding and mindfulness, time out. In addition to my type A personality, liking to do everything, I work really hard to have that balance. And it wasn't enough. And magnesium wasn't enough, but it was helping. I did try a series of massage and acupuncture. That wasn't helping. And I was like, okay, I'm going to go to a naturopathic doctor and talk this through. And it was discovered, like even though your periods are now more regular than they've ever been, like every 28 days, progesterone flow. So I started on cyclical progesterone, and what a difference, because I also went through this time of joint inflammation, like osteoarthritis started to kick in my hands, and we had moved physically. So I was doing a lot of lifting, and that was the trigger, but I was typing a lot. I guess that was aggravating it, phone use. I had to take some serious breaks, but the thing that made the biggest difference was the progesterone, because I would notice that my joints would go crazy swelling just before my period, and progesterone helped take that away.
So let's ask you about this, because I actually remember you saying, oh my gosh, Mary, I don't know how I'm going to type, how I'm going to see my patients. This has been going on for how long? Was it during COVID?
2 years. No, not 2 years. Hang on, let me think. So March, April 2021. So 2021, okay. Yeah, and we're now in September 2022. So yeah, it was like a good solid year. I would say 6 months of really bad. I thought I was even getting dragon dictation. There's this software company you can, use so that you can dictate. I was thinking of hiring a person to help listen to my patients and type. Like, it was bad. I had some serious osteoarthritis happening. And my mom has, I have pictures of her with her hands when she was in her 70s holding my babies. And it's like she has claws, or like she's wearing mittens. Her osteoarthritis is so bad. It looked like her fingers were so thick. It was like mitten hands or glove hands, right? And so I can see that the shape of my fingers very similar. So, but progressing that way. And I was like, what can I do? I need to do something. I tried MSM, glucosamine and curcumin and I think all the herbs that I tried and not just tried and stuff. Like it was, and I'm still on them because I feel like it's probably all contributing to help, but I had to get prescriptions. I was on naproxen. I was on meloxicam. Like I went to a rheumatologist. Like this was serious stuff.
So thank you for sharing this. I think it's really, really important because, as women or living in this society, it's like we can do it all, we can bear it all. And it's like you want to suck it up and just figure it out. And it's okay to get help, right? Because sometimes we don't want to get help. It's like, oh, but I identify with myself as a natural person. So, can I venture out and take meds? And, Tanya and I have been around for so long that maybe when we first started practice, I don't know about you, but when I first started practice, I was way on the other side of the spectrum.
Oh yeah.
All natural.
Too much.
Come on. It's like, come on, meds.
Yeah,
really, we don't need you. Yeah. But now it's like, okay, there's a time and place for everything. And with the severity, especially of what you were enduring, it's like, yeah, of course, if there's something that can work, why not? And
I couldn't operate without having buzzing fingers.
That's no way to live.
Bad. No.
Yeah. So then share with us then when you started taking it and how long the effects, or how long did it take before you saw effects?
So it got progressively, so right away it helped sleep and the feelings of, I guess because with my mother, going through her situation, I would get very emotional just before my period. I would cry every month. I'm just sad about her. Right. Right. So then I found it was really helpful with that. So not that I don't want to be sad, but I don't want to be so deeply sad. I was getting tired of it. It's 3 years in. And so it really helped with that right away because I could sleep and I was having nightmares. And then the joints, I would say after 3 months, 2 weeks into the, when I was ovulating, just after ovulation, I was like, oh, feelings aren't killing anymore. And I also noticed I was getting headaches. It was probably, again, emotionally related, but that's so much better. It's way better. Yeah. And
that's awesome. That's really great to hear. And the reason why I also bring this up is, in this age group, right? We don't really like the words perimenopause and menopause, and especially in this day and age, right? Because a lot of women can be taking care of their health and they don't want to associate, and certainly in our minds, we don't think we're getting older. And yet the reality is our hormones, they do start to decline. I mean, that stuff is real. So there's only so much we can do. And back to, we talked about it a little bit in our other episode about cyclical progesterone, where we talked about Avrum, Dr. Avrum, Bluming, and I forget Carol's last name, Carol Travis, who wrote Estrogen Matters. And I loved how they talked about, when people put up a fight and say, well, why would you do hormone therapy? Because that's not natural. And then they say, well, it's not natural to live so long. Right. I found that so funny. And I'm like, oh my gosh, you're right. Yes. Right. Because, because
we have infectious diseases, but then we figured out antibiotics can work.
That's right. Exactly.
Right. So we used to die in our 40s, and we used to die before we'd hit postmenopause, or we'd die shortly after.
Yeah. Right? And if you think of the animal kingdom, I don't know if you've ever seen salmon swimming upstream just so that they could drop their little, what do you call that when they it's not a litter when they don't have a litter. What do they have? Oh my gosh, you guys, fish experts, please tell me. What do they have?
In the comments below.
But all I know that it's like called ikura in Japanese because I eat sushi.
Oh,
that when they drop their little fish eggs, right?
Yes, yeah.
But like in their life cycle, they basically drop their little fish eggs and then they die. That's it.
Yeah.
Right? That's their reproductive lifespan. So like as humans, we go like way beyond, right? Like we go through our reproductive years and then we don't die.
Yes.
Not now, right? No. For the most part. I'm not going to say never.
We have a very we had an amazing life after postmenopause.
Yes.
If we take care of ourselves, we have to take care of ourselves. I mean, there's the odd individual, not that they're odd. Well, maybe the genes are amazingly odd, but then they can just get away with, smoking and drinking in the to 90, never eating a vegetable or fruit and be quite happy. Maybe they have a really good outlook on life and amazing mindset, but most of the time that does not happen. And if you're doing all that, then you're also on a slew of medications to
perhaps not all the time. Not all the time. Let's not say that.
That's what I'm saying.
Oh, got it.
If you're not taking care of yourself and you're doing, the unhealthy lifestyle stuff.
Got it. Yes.
Eating poorly, smoking, drinking, you're probably also on medications. There are also many times where you're not smoking and drinking and taking care of yourself and you don't need any medication.
Yeah.
That's the best, right?
Yes, of course.
However, the hormones are a way to help prevent dementia, improve bone density instead of having to take medications that have, pretty drastic side effects like diarrhea to help bone density and possibly developing jaw cancer. Like it's just such a low possibility of really making a big difference, and you only get the improvement while you're on them, right? Like the Fosamax or like the medications basically that impact bone density that they've discovered can kind of help with bone density.
But that can cause other issues, unfortunately.
Other issues,
right?
Yeah. So, and then dementia, there's no medication really that can help prevent dementia. Obviously, we do the very best that we can to eat healthy and exercise, which my mom did very well and still developed it. It makes me think, how cool would it have been had I known? But, you can always just look back and learn and move on. But to have put her on hormones, because apparently estrogen can reduce the chances of dementia, developing dementia, or delay, even if you have the genes. So she has the genes and thankfully I don't. The ApoE alleles, which you can test for, but beyond that, right? It's not just the genes. So it's bone density, dementia prevention, and then obviously it's, there was a book on estrogen back in the day before it was recommended to everybody that was actually funded by the pharmaceutical industry.
Yeah, horrible.
On the fountain of youth using hormones. So there is like an anti-aging component, but it's not just, it's not that simple. It's not like, you're not going to never age going on hormones, but they can be very helpful in, reducing cardiovascular disease, which really is the number one reason we die these days.
And so again, the point behind that is because we're being unnaturally getting older. Yes. So considering hormone therapy is actually not a bad thing. And for some, it's very helpful. And so in your case, you are one person that says, oh my gosh, it's made a profound difference. And if I may add in, Dr. Avrum Bluming, he's an oncologist and he was against estrogen until he did more research and then found out, oh my gosh, like not a lie, but like there's a lot of misconstrued facts and findings and reporting. And so he wanted to set the facts straight with Carol Travis, and they wrote Estrogen Matters. And the point is that Dr. Attia asked him, it's like, is there something personal about this? And he's like, generally no, and professionally, but actually my wife at 48 had cancer. Breast cancer, survived it, did chemo and the whole 9 yards, and afterwards was not getting better. So, 48, right? That's perimenopause. Yeah. And when she did the treatment, she went straight into menopause. So there was like no break. It went bam, straight to menopause. And for her, she suffered greatly. And initially, the first 2 years, it was like, oh, it must be from the severe treatment.
Yeah. But then she suck it up.
That's right, which women generally do. We suck it up, and we don't say anything. And then in the end, it was like when it really started to impact their lives, like I think her memory or something was going really bad.
Yeah, she couldn't retain information from reading books, and she's such a big, avid book reader, and so she'd be reading and just not retaining.
Yeah, so finally he agreed to give her estrogen, and like within a week, all of her symptoms turned around. And so it's not like doing this blindly, right? No. We take matters in our own hands with the right information and with what works for us. And so this is definitely a conversation that is beyond Dr. Tanya and myself. It's like you need to have it with your physician. And if your physician doesn't know, then you need to refer them, and you need to perhaps read the book Estrogen Matters. Yeah. And we don't get any endorsement. This is us just telling you this, right? We don't know them. And in fact, we would love to connect with them and actually interview them. So, again, there are lots of things that can help. And Tanya was speaking to like doing all the right things, all the things naturally, which we all should look at anyway for overall health. And if that's not enough, why not look at and be open to, some form of medical help? And right. And he was saying as well that a lot of women, they end up like, perimenopausally, they have sleep issues, they have anxiety and depression. And so what do? You get sleep meds, you get antidepressants, you get painkillers for pain, all these things. And in the end, when the person just takes that one thing, like hormone replacement, estrogen with the progesterone is what they prefer. Yeah. They found the symptoms all going away. So not having then to take any of this other stuff.
Correct. Yes, which is quite amazing. And I've seen it over the years where patients will get dismissed as, having just an overwhelm because they're anxious because they're raising kids, like small kids, right? So, because a lot of women do wait a little bit later to have children. So, doctors, will kindly say, look, you're just an overwhelmed mom, you're in your 40s and you've got young children and you're working and you just have the overwork syndrome and that's why you're anxious.
Right.
And they've tried everything. And I've seen it where then you've tested, like I've tested a woman's anti-malarian hormone, which is kind of a cool test to see when you can kind of judge when they're going to go through menopause. And if it's ridiculously low and their periods are irregular, they're in the thick of perimenopause. Right. And when you put them on hormones, they're like, oh, I can sleep. I feel normal again. I don't have those, anxiety symptoms that it can kick in quite drastically, quite quickly, and much safer than using and advantageous because it's replacing hormones you would normally make compared to, say, going on a benzodiazepine, which can be very addictive and can in the long term cause, symptoms of dementia. We're trying to prevent these things, right? So lots of advantages. One of the things that I liked about Carol and Avrum Bluming in that podcast was they also talked about the bias of like, do you have a bias as to why you're talking about this? Do you want everybody else on it? Because you're on it. You want to make sure, that you feel good about being on it. And that is not a reason that's
not their message. No.
That's not theirs or ours.
Right, of course.
I literally am sharing because I want people to know that they don't need to be a hero, that they can get help and that they don't have to just jump on antidepressants or painkillers. There are alternatives. You want to look at the big picture and look at other options. And I've been prescribing this for, with the help of a medical doctor for years and then personally prescribing to patients since 2017. And it can make such a difference. I've seen so many cases where patients are feeling like insomnia and depression, and they are all of a sudden able to do the lifestyle changes I want them to do. And that's the other thing. Like if you can take something that's going to then allow you to eat healthy and exercise so that you can then lose weight, you're doing so many positive things. You're now reducing your risk for type 2 diabetes. And it wasn't a statistical significant difference in the Women's Health Initiative, but if you do evaluate the data, there is some talk of it maybe even helping with type 2 diabetes prevention. I think it's a whole multitude of factors in that way. But if you can use something that's going to help you be healthier, then it makes sense to me.
And we'll put that all in the show notes, right? Some of the resources that we're mentioning today, for sure. And
they're in my link tree already. They're in my link tree.
Oh, okay, great.
And the original articles and peer
perfect. Okay, but we'll also have it on myfertology.com in our show notes, so you can access that. Yeah. And so let's also say that not all women will need to have these kinds of severe symptoms. So we're not saying, oh, gee, every woman should be on it, right? And so like, if it's enough, like if you're not doing anything at all, well, let's do something. And it may be, let's begin with more natural solutions and let's see if that works. And if it doesn't work, then maybe then perhaps do the reading, do the research yourself, and come to a place where of understanding and perhaps try if you're open to it, right?
Yes.
So we're not saying one way or another at all. Yeah.
Correct. No.
Okay.